So today our plan of action is rather complex. As you remember, our patient has had large volume liposuction of her thighs with skin tightening using Renuvion, and she's got this contour irregularities that you can appreciate. The purple areas represent liposuction, and it's not a ton of liposuction. Sometimes it's only 10 cc, sometimes 20, sometimes 10. It's just to make the thigh contour more even. The blue areas represents where we're gonna do fat grafting, and the orange represents where the center of the depressions are. So if you follow that, we have liposuction, we have fat grafting. On top of that, we're gonna be doing liposhifting, moving the fatty layer underneath. We're gonna place fat in areas that have depressions and indentations, and we're gonna release some of those internal scars. So in reality, these thighs are gonna get liposuction to some degree, fat transfer, release of deep scars, liposhifting, and then we're gonna tighten the skin through a lower body lift so that now we have a tighter skin envelope holding everything in place. And on top of that, we're gonna apply external pressure, trying to mold this fat and make sure it's smooth. So it's unfortunate, but once you have contour irregularities, it's really hard to correct it. And with all our best technologies and efforts, we probably are gonna get not a perfect result. We're gonna get an enhancement, whether it's 50, 60, 70%. It really depends on what we find inside, how much internal scars we have, how much of the fat survives, how effective the liposhifting is. So there are a ton of variables. I'm sure we're gonna get a significant enhancement, but as I've told her, I can't promise her this is gonna be more than 50%, but even that 50% is gonna make a significant difference. The lower body lift is really needed in order to tighten the skin envelope, and obviously to take care of the sides. Keep on rotating where we have still more of those issues and problems, and the buttock laxity and so forth. So a combination of taking care of the fat and the skin, I think, is needed in order for us to get the best results for her. And you can see that we have a good amount of work to do. This is probably going to be one of the more challenging cases that I have to do this year, but we'll get you there. You ready?
Yeah.